Welcome to the Keto Power Podcast. I'm Claude, your coach, here to help. Before we get going, once again, I want to remind you of our holiday sale. It's a Bring a Friend for Free sale. All of December, if you book, whatever you book for, you get the option to bring a friend for free. And you can split the cost between you two. Now, you don't have to take your appointment in December as such. You can book now and into January if you want to save it for after the holidays. Totally understand there, but as a New Year resolution, it might be a good idea to get your health in order and join us at Keto Power Fitness. All right. So for the next few videos, what I'd like to do is go over a few studies, and we're going to have a look at different options to increase your chances of avoiding severe outcomes should you catch COVID-19. Now, the thing you have to remember is, okay, we're all social distancing, we're wearing masks, and we're trying to avoid this altogether. But realistically speaking, I know the vaccines are coming out, they're trickling in slowly, but not everybody's going to have access to them right away. It could be still a month. And so, and some people are more at risk of catching the disease. If you want to put the odds in your favor, there's a few studies that are out now that give us some pretty good clues as to what you can do to put the odds in your favor. And we're going to be going over a few of them in the next few podcasts. I'm going to go over a nice short one here in a second. And this is a study. Let me just put my screen share on here. Okay. All right. So this is a study that comes from Spain, and it's titled Admission Hyperglycemia as a Predictor of Mortality in Patients Hospitalized with COVID-19, regardless of diabetes status. Data from Spanish SIMI-COVID-19 Registry. Okay, so we're just going to go through this. It's a study from Spain, and it's just the abstract here on this page, but it's quite telling. It's quite straightforward. Now, what they're calling admission hyperglycemia is the patients come in, they've got symptoms, they, have problems breathing, they decide to check into the hospital, and they do a blood test, and they get their glycemic status. So that's the admission hyperglycemia here. And some of them may have been diabetic, some of them not. But regardless of status of diabetes, this turns out to be a fairly important factor in predicting the outcome. All right. And blood sugars is something that is fairly easy to control with diet and lifestyle, and that can be done ahead of catching the disease. And if you happen to catch it, start having symptoms, you can still intervene in keeping your blood sugar low. Now they're not pointing to causality here, but definitely something that should raise eyebrows and something that's fairly easy to control. And for the most part, controlling your blood sugar, there's no negative side effects for most people, and there's a lot of benefits in other benefits than whether or not you might be exposed to the virus. So there's not a whole lot of reason not to lower your blood sugar and stabilize it at a nice low level. Okay, so the abstract reads, hyperglycemia has emerged as an important risk factor for death in coronavirus disease 2019. The aim of this study was to evaluate the association between blood glucose levels and in-hospital mortality in non-critically, there's a word missing there, I'd imagine critically ill patients hospitalized with COVID-19. The method. This is a retrospective multi-center study involving patients hospitalized in Spain. patients were categorized into 3 groups according to admission. So blood glucose levels of below 140 milligrams per deciliter. The second group would be a group that was at 140 to 180 milligrams per deciliter. And the last group being above 180 milligrams per deciliter. Okay. The primary endpoint was all-cause in hospital mortality. So basically, they noted those that didn't make it, all-cause. Now we know most of these patients were checking in for COVID. They might have had some comorbidities, and they passed away. It doesn't state one cause or another, just generally. So that's all included as an outcome in this study here. Okay. Results of the 11,312 patients, only 2,128, that would be 18.9%, had diabetes. Okay, so the minority of them had diabetes. And 2,289, so 20%, 20.4%, died during hospitalization. The in-hospital mortality rates were 15.7%. So for the below those that passed away, 15.7% had a blood sugar level below 140 milligrams per deciliter. So the first group. As soon as you go to 140 to 140 milligrams per deciliter, the percentage goes up to 33.7%. So that's like more than twice as many. Okay. And then as it goes up, the blood sugar goes up higher than that, above 180 milligram per deciliter. The results came in at 41.1%. The cumulative probability of mortality was significantly higher in patients with hyperglycemia compared to patients with normal glycemia, independently of pre-existing diabetes. Hyperglycemia, after adjusting for age, diabetes, hypertension, and other confounding factor, was an independent risk factor of mortality. Blood glucose of 180 milligrams per deciliter. Confidence, 95% confidence interval. So they're just stating the statistics there for the study. Hyperglycemia was also associated with requirement for mechanical ventilation, intensive care unit, admission, and mortality. Okay, so there's a link with all-cause mortality, but also with need for ventilation and going to the ICU. That's been noted as a correlation as well. Okay, so their conclusion was admission hyperglycemia is a strong predictor of all-cause mortality in non-critically hospitalized COVID-19 patients, regardless of prior history of diabetes. Now, remember, we're talking people that passed away, that checked into the hospital, that were non-critical, okay, to start with. Key message: admission hyperglycemia is a stronger and independent risk factor for mortality in COVID-19. Screening for hyperglycemia in patients without diabetes and early treatment of hyperglycemia should be mandatory in the management of patients hospitalized with COVID-19. Admission hyperglycemia should not be overlooked in all patients regardless prior history of diabetes. So that should be of prior history of diabetes. So basically they're saying they should be screened. Even patients that come in non-critical should be screened for hyperglycemia, should be treated for hyperglycemia before there's further deterioration of their health. And obviously the takeaway for us is don't wait till you're a non-critically ill patient with COVID-19 and checking into the hospital. You can control your blood sugar ahead of time. If you're looking for ways to do that, give us a call, 250-200-0788, all across Canada from coast to coast. And we'll tell you how. We're Keto Power Fitness. You can also reach us at info at ketopower.fitness. And we hope to hear from you if you're having hyperglycemic problems, because it can make the difference between life or death should you come in contact with the COVID-19 or the SARS-CoV-2 virus and come down with COVID-19 disease. And like I said, I mean, that may be one motivation to do it, but also controlling your blood sugar will make you feel a lot better, a lot healthier. And by the time your blood sugar is high, you're already, if you're not diagnosed with diabetes, you're already pre-diabetic. A good way to test if you're getting into trouble as far as insulin resistance, which means that if you have insulin resistance for a long time, it may not affect your blood sugar. You can be tested for fasting insulin levels. If your fasting insulin level is high, then you're at a stage where you're compensating, okay? And by the time your blood sugar gets out of control, starts creeping higher and higher, then your body is no longer compensating. Okay, so changes in diet, changes in lifestyle can go a really long way. And the beauty of the keto diet, when it's done properly, is that it's sustainable in the long term. You're not starving yourself. You're limiting stuff from your diet that causes insulin resistance, and you're able to maintain that because you come away from eating a meal and you're not left hungry. You're not left trying to spend more calories than you're taking in all the time. Okay. You're eating things that are satiating, that you feel full, that you feel energetic, and you're also working on eating stuff that's revving up your metabolism, right? So that you're not, if you're constantly in calorie deficient because you're eating less and exercising more, what happens that you may spend a bit more calories while you're exercising, but when you're not exercising, you kind of rev back down to your basic metabolic rate, and that starts to get lower and lower because your body's trying to fight the fact that it's slow on calories. Okay, so that's hard to do in the long term. Okay, in fact, it has deplorably bad track record as far as dieting and then gaining back all the weight. Okay, that's not what we do here. We want you to stay healthy. We wanted you to rev up your basic metabolism so that you're energetic, you're awake, your mind is clear, and you're enjoying life again. Okay, so like I said, give us a call if you enjoyed this video. Look forward for more videos like it. Make sure that you press subscribe and ring the bell, and please share the video if you found it useful. Maybe your friends will also. Have a great day, everybody.